Now come to the complication of pneumonia. What is the most common complication of pneumonia? It is parapneumonic effusion. What do you mean by parapneumonic effusion? That is accumulation of the exudate in the pleural space is called parapneumonic effusion. Why this parapneumonic effusion happened in pneumonia? Because the virus bacteria enter into the lung and goes and accumulate in the alveoli. The alveoli present near the visceral product gets inflamed, and the visceral product get inflamed, and due to inflammation there is production of edema and fluid. This fluid will accumulate in this area, causing pneumonia effusion. Next, what are the other complication of pneumonia? That is the most dreaded complication of pneumonia is accumulation of pus in the pleural space. It is called empyema thoracic. And what are the most common organism causing empyema thoracic? In developed country, the most common organism causing empyema thoracic is Streptococcus pneumoniae. And in developing country like India, the most common organism causing empyema thoracic is Staphylococcus aureus. Always remember, a patient age less than 2 years having empyema thoracic, it is mostly 99% it is due to Staphylococcus aureus only. Now come to the pathology of empyema thoracic. In empyema thoracic, there are three stages. First stage is exudative stage. What do you mean by exudative stage? The virus bacteria enter into the trachea, goes to the bronchus, accumulate in the alveoli, and they gets proliferate here. And due to this proliferation, the virus bacteria proliferate here, and the alveoli near to the visceral product gets inflamed. And due to this inflammation, the visceral product also inflamed and produces lots of edema. And there is also accumulation of neutrophil because of cytokines. Due to this inflammation, there is massive cytokine production, and this cytokine call the neutrophil to come here, and there is also presence of macrophages. So in this exudative stage, there is accumulation of the fluid and also neutrophil and also macrophages, and this is sterile in this time. After that, there is next stage is fibrilloproliferative stage. What happened in this stage? The macrophages and the neutrophil and also the other fibroblast produces fibrin clot here, and this fibrin clot gets attached to each other and produces is a pocket, and in this pocket there is a accumulation of pus. That means mostly neutrophils and the bacteria mainly proliferate in this pocket. After that, if the stage is going on, then the last stage is organization. That means the the fibroblast again proliferate and massively produces a thick area, and this thick area restrict the lung and the pleura to expand, and this stage is called organization. So there is three stages of empyema thoracic. First stage is accumulation of the free fluid in the pleural space, that is called exudative stage. Then there is proliferation of fibrin, and also there is production of fibrin clot and leads to many small pocket of pus. After that, there is organization of the fibrin pockets and leads to lung restriction. In this X-ray, we see there is massive homogeneous opacity on the right side, and this is when we aspirate the fluid, we found there is accumulation of pus. So the investigation of choice is aspiration of the pleural fluid and cytology test. Now comes to the treatment of empyema thoracic. First, we have to start with cloxacillin, or if we present in India, if the case present in India, then we start vancomycin. As I said, the most common organism causing empyema thoracic is Staphylococcus aureus, and we continue the treatment for 4 weeks. Along with this, we do the thoracocentesis. Remember, any pus present in any hair of the body, it should be removed. So thoracentesis and chest tube drainage. It is the first and foremost treatment of choice. If the patient having fever or symptoms is not cured after 72 hours of antibiotic, then we hire up the antibiotic and also we do VATS surgery. So this is also MCQ. Now come to another complication of pneumonia, that is lung abscess. The most common cause of lung abscess is aspiration of infected materials. Aspiration or foreign body aspiration is the leading cause of pulmonary abscess. The most common organism causing pulmonary abscess are bacterioids, and other virus bacteria may causes lung abscess are Fusobacterium, Streptococcus, Staphylococcus, etc. The anaerobic and aerobic organism both are equally causing pulmonary abscess. The diagnostic choice or investigation of choice to diagnose lung abscess is chest X-ray. In X-ray, what we get? So in X-ray, we found a thick wall cavity along with air fluid level. And the gold standard investigation is CT guide aspiration of the fluid. It is a MCQ. In this X-ray, we have seen that there is thick rounded wall and there is also air fluid level. This is fluid and this is the air. Now, come to the empirical treatment. When you suspect a patient of lung abscess, before aspiration, we start empirical antibiotic and the antibiotic of choice is amoxicillin plus clindamycin. As anaerobic and aerobic coverage we have to give, and it is continued for 4 to 6 weeks. And we can also give amikacin if we suspect it is a case of aspiration of the foreign aspiration pneumonia or we suspect a gram negative organism. If the patient is not improved, then we hire up the antibiotic with vancomycin and clindamycin. If the patient is not improved, then we hire up the antibiotic to meropenem and clindamycin for 4 to 6 weeks. If the patient is symptomatic after 7 days of proper higher antibiotic, then we do the surgery, and the surgery of choice is minimal invasive percutaneous aspiration. It is CT guided, so it is also MCQ. So these are the complications of pneumonia, and these are the all MCQs for all India exam. Thank you.